invite me.
All right, so why don't we go live?
Okay, and we are now
I need
live.
his chair.
This is Senate Appropriations, and we're continuing our work on bills that are carrying appropriations, and we have a bill, S-195, that has to do with certification of mental health peer support specialists and would expand peer operated respite centers, and it carries an appropriation of $2,000,005. We have with us the reporter of the bill from Health and Welfare. Senator Hooker, do you want to present the bill? And also, one thing, in the budget adjustment, we did have money in the mental health budget for certification. And I wondered if you can just crosswalk what's here with what we've already done in the budget adjustment relative to certification.
I'm not sure how much money was in the budget adjustment for that. This type of certification is for peer support specialists who are already doing the work, but we're trying to standardize the training for them, trying to make sure that their work is consistent across the board, across the state, and to allow drawdown from Medicaid, because as a certified peer support specialist, they would be able to do that. This is something that CNS encourages. It's done in, I believe, 46 or 8 other states, and we are hoping that we can bring that to Vermont. These people are invaluable in helping to support folks who are in crisis, because they have lived experience and they are able to relate to those folks who frequently end up in the emergency rooms and in psychiatric beds in the hospitals. So this bill is actually a combination of 2 separate bills. One was for peer support specialists and the other was for the respite centers. And the hope was that we could establish a number of respite centers around the state to help with that crush of people who have been staying for hours and sometimes days in emergency rooms. I heard a story a while ago about someone who was actually in the hospital for almost a year because there was no place to go. So these centers would act as step-down beds. They would act as places that people could go instead of the emergency room, instead of the hospital, and spend some time and get the help that they need to be able to go back to their lives and function.
So are these residential?
They would be, there's one in the state already. It's Alyssum, it's in Randolph. It's been in existence for years. It's, has a 95% occupancy rate. People, they have a waiting list for people to go there. And the research has found that people who are able to go to these centers actually have better outcomes. They feel better about themselves. They're able to go back and get into the mainstream, if you will, and not cost the state as much money. Yeah.
I just wanted to ask, what does the security look like? It says a home-like environment.
It is a home-like environment, and this is all voluntary. I mean, these people ask to go there.
Mm-hmm.
They're not placed there. So it's staffed 24 hours a day, 7 days a week. But there, as far as, secure residential types of that type of stuff.
Well, I'm just wondering if
that
somebody
it's
has a
safe.
break and they become violent or.
And that would be up to the staff, I assume, to take care of, and I'm sure that, they would be in communication with other resources, other.
I mean, one of the reasons I ask is because the state's looking to replace Woodside and
Yes,
experiencing resistance from communities because they feel like security wouldn't be enough to prevent them from having some negative effect from hosting.
and again, you know, these are residential type beds. There would only be 2 beds per unit, per center. And I think that the experience of Alyssa in Redmond has shown.
Is it in Randolph or Rochester?
Yes.
In Rochester.
Rochester. That's right.
We have just
These are
one now.
our words.
I just want, I finished.
I'm finished, thank you.
Senator Starr?
We have just one now.
There's only one, yeah.
And who pays for that? Who's footing the bill?
Here it is, right here.
This is new.
Yeah.
It's right here on page 2, under peer operated, so they get 477,000 from Department of Mental Health.
475.
Yeah.
But now, yeah, but we don't have only
This-
one.
we
So
have
now
one.
we want to get these specialists to go and work in these places, maybe on a rotating or as
Well,
needed.
these would be positions for these specialists, and it's another point of the certification process was to allow these people who have lived experience and frequently have a difficult time advancing
Yeah.
in, you know, in an area.
What do you mean?
To kind of move up the ladder, to have employment, consistent employment. This would be one way to help people who have had severe issues in the past and have overcome them,
Oh,
to
good.
be able to move into gainful experience, you know, gainful employment. But as
Why
far
would
as
we
who's-
hire these people before we have the places? Why wouldn't we try to establish these?
Well, and
Can I help?
no one
Okay.
has,
For the record, Joint Fiscal Office, Noel Langlois. This was actually 2 bills combined into one, so I might recommend you think about this in 2 pieces. The first part is the peer specialist certifications, and then the second part is the peer respite. Don't think of them together. Think of them as 2 separate bills in 1 bill. So that's how, and you're thinking about them, how the certified people would work in the respite center. So that's not how it's intended. It's the specialist with 1 bill, the respite with the other bill, and don't think of them intertwining.
And some of there are peer support workers, or designated agencies as well.
That helps us understand.
And residences that the mental health,
Yeah.
you know, like the local mental health agency has for those, I don't know how it would intertwine with them. They have like emergency placements to avoid somebody being stuck in the emergency room with residential attached to it.
So, our question is around the money, and,
So do we strike
Well-
section 6
well-
and 9?
then we would move forward to create the certification program, and that's what I was asking about what the budget adjustment was going to support, because you can have this certification and the development of these positions, and then, which can occur on a separate track, adding more of the facilities. At this point, we haven't really made commitments around budgeting. We are really, that's why we were over next door. So the question becomes one, what would the bill, if you don't have the appropriations at this point, because basically we are having to take all the appropriations requests and look at them in totality. And that's where we get to the 100+ million, and the number of it actually came out of the Health and Welfare Committee.
So this doesn't take effect until July 1st anyways. So the budget will pass and we go into effect anyways.
Well,
Well, we have another complication here, and that is our Medicaid global commitment waiver cap is very close to being hit. So the more we say, oh, well, let's match to Medicaid, we are capped on the amount of Medicaid dollars that we can draw down. And so we have, I know people in the peer support would have feelings about the designated agencies of specialized service agencies. We are sitting here with a 3% increase in the governor's budget. They're saying they need 10. They operate other facilities, including the facilities for, and maybe not everybody knows this, the 248 population, and those would be individuals who level of intellectual functioning make them not competent to stand trial. And so they have, in some cases, have been, have committed serious crimes, yes, to put it bluntly. And so, and then the same is true for people with a mental illness diagnosis, like Louis Hines, for example, or well, the woman in your area that came in and shot people, that are in facilities. And so we're getting that part of the system saying we 3%, and we're operating facilities and we've got workforce. So we're getting to, we're having to look at that, the extent to which we're supporting that part of the system and how to make it work. And I do understand the complementary nature, and I understand the value of peer support. It's just we haven't figured out how much money we have, and we might have less depending on what the committee next door decides relative to some of their tax reduction proposals, because the House actually reduced revenues by about $50 million. So that's why we are I'm on this. So my question is, if we pull out the appropriation, are there certain policy pieces that we would still want to move forward? Because we did approve the money in the BAA.
For certification, and certainly the certifying of the peer support specialists would help in the workforce situation for all of the agencies, because they do work across agencies.
That's what I was thinking.
So, So my other question though would be about, we've heard, especially throughout the pandemic, how people are stuck in the emergency room or stuck in the psychiatric ward because there's no place to go. So I don't know how that is justified with, the DAs and other agencies.
Well, we got a mess. We've got a lot of money, right? But we don't have a lot of money because our base appropriations are at the hill, and we're starting new programs, and we aren't even funding the ones we got properly.
Now, there isn't a dime in here to increase
And
for
we're
services.
providing our state employees with
over 10.
over 10% increase. So you tell me how we're gonna do everything.
Well, I haven't got it figured out yet.
Well, Bobby, let me know.
I can't help you.
Well, this is what the dilemma is, and I really everybody wants to do these things, and I certainly agree with Senator Hooker that we have a crisis in mental health. But is that partly exacerbated by the fact that we can't hire workers in our designated agencies because at 3% increase, they can't compete with the 10% increase that state employees are getting?
Yeah, that's right.
And that we haven't solved our beds situation for the mentally ill since the Waterbury and Irene closure. And that, even before that, it was a crisis, right? But at least we had the state hospital at Waterbury, and then it flooded, and we've been really, and now in the juvenile system, we're in a crisis stage because we don't have the workers to work in the homes to take the kids, and we don't have the places to place the mentally young kids who are having significant mental illness and emotional trauma. We don't have the placements for them because we closed Woodside because we couldn't place them there anymore after Judge Crawford's decision. And because of the abuse of staff members. But we can't replace that because Newbury doesn't want it, Windsor doesn't want it. And so Bennington's stuck with it, but it can't keep going because we can't get the staff to work in these programs for, $15 an hour.
Catch-22.
So this solved that problem?
No.
I think it exasperates it, and even though it's a great idea, but I'm really frustrated right now about the attitude in this building that I'm seeing when you provide that $54 million in tax relief. And we're stuck here trying to
Pay the bills.
pay the bill. And we're not in the governor's budget, doesn't even pay the bill. It keeps those designated agencies at the 3% increase, and they can't hire staff. It keeps the other programs that the state relies on at that, but it signs a contract, the administration signs a contract for 10%. Don't begrudge our state employees 10%, more power to them.
And that doesn't even include the operating cost increase.
Okay, the rant's over. Thank you, Senator Hooker, for putting up with it for a few minutes.
Well, I think it's just showing the physical reality that we're confronting here. Because there's no increase at all for Youth Service Bureau. So Spectrum is saying, gee, how do we deal with the youth? There's nothing here for us. And the Parent Child Centers, there's nothing in the budget for them. I know that you passed a bill that would give them more money, but until we can figure out how to make it work,
So we strip the money out of that.
we strip the money. So we're gonna have to do the same here. I think if we can move forward on the certification and then look at how we can over time develop more capacity within that treatment. That's something we all acknowledge needs to be done. So
Well, I just want to say that, this type of facility, in the long run, pays for itself. It is less expensive than the other types of facilities that we already have in place and that are understaffed and perhaps under-resourced. But they are a cost-effective way of handling people who have these issues. So, that's something that I hope that you'll think about. Certainly, I think going ahead with the certification is critical, not only for the people who would be involved, but for the agencies that need this help, that need these workers, that need people to go out there and do the work that needs to be done. And I don't know what the future will bring. I hope the pandemic is behind us soon, but the effects of it, I think, are going to be longer lasting, and we're going to have to deal with it. So that's,
we'll see.
I appreciate the difficulty. There's never enough money for all the needs.
Well, we've got to figure out,
It would be to strike section 6, 9, and 10. If we struck 10 is going after the Medicaid, which we aren't sure how that would work against the cap.
I'm really worried about that. I don't think people have really registered, because historically, it's always just been theoretical. And under this new and moving the choices for care into that local provision waiver, the folks at the agency are working very hard to see what they can negotiate. Otherwise, we are in a world of fiscal difficulty under our Medicaid program. And I don't know how to say it, and I don't know how many times to say it, but it's something new this year. And it's something, before we had so much money in the budget neutrality, we could never have ponied up the general fund to draw it down. But that world is greatly altered as of now. And
How's that determined?
when you negotiate the Medicaid waiver, you're given flexibility in what you can use those Medicaid dollars for. And we have over $100 million of expenditures that we use Medicaid to support that otherwise, without a waiver, we couldn't use those dollars. So it's,
But it's almost reached
But-
its peak.
but in order to get the flexibility, the federal government says, we will give it to you, but you cannot have a program that would cost more than it would have cost under the regular rules.
It might do us good in committee to get a half an hour presentation about where we are with the cap.
Have you had that in health and welfare?
I'm sorry, I didn't hear.
On the
No.
budget neutrality and the waiver?
And where we are with the cap.
We haven't talked a lot about it. We did talk about the fact that the waiver is going to be re-upped and that we were coming close to that. Yeah, we did.
I think it would be good to get somebody in to talk about it.
Yeah. The other thing, with regard to the certification though, I know that it, well, I don't know how this would work, but they would be eligible to draw down Medicaid. How would that, giving them a certification, interact, I guess, with the cap and.
It would be, and have to be members of that.
Yeah, it would have to be part of it, yeah. But the very fact that the governor asked, and we granted, I believe it was in the governor's proposed BAA. I don't think it got added on our side, did it?
No, I'm just gonna look at Rich's note again.
I think it's indicative of, the value and there's a good evidence base around peer support. The same is true in child welfare, the same is true in a couple of other areas, so. Yeah, so, yes, right. they've had
And
a-
these peer support specialists are being used in so many different areas.
I don't have the amount, but it's funded out of the 10% bump in the home and community-based waiver, the certification. Pieces. So,
And the BA,
Yeah, the
it's
BAA
like
money.
30,000, wasn't it?
I don't have to.
Yes, that's what it was. But my question was it included in the governor's recommend, which is, to me, it's indicative, the administration supports the concept and initiated the request as opposed to having it added by the legislature. That was really what I was asking. Well, Cheryl, we understand
Thank you.
the purpose here. But we're gonna need to have, Katie's here in terms of,
Find
what
a
we do
couple
with the
of
money.
more than-
Send it over.
Okay. And Senator Weston has moved that we move the bill.
Gonna strike section 6, 9, and 10.
Well, I gotta see where 6, 9, and 10 is.
Are you keeping the Medicaid portion?
No, that's 10.
Okay, it's 4 too. It's 4.
It's 4 too.
Yep,
I didn't
section
see.
4, 5. So you want to get rid of 4, 5, you want to get rid of the appropriation in 6.
Yeah, yeah.
And then what are you keeping from the rest of it?
9 is the 2 million and 4 for 500,000.
But if you don't have the funding, how do you summarize the annual activities of the center?
I don't know.
Yes.
What I was gonna say, so for instance, the certification program, the prior sections require them to create it and the money funds them creating it. So if you strip out the money, you can't create it. So without like the
It won't be
sections.
created anyways till July 1st.
It's going through.
So
Yeah,
effective date for the whole act is July 1st, right?
2022.
22.
Which
what I'm saying is
means the budget would have passed and we will have made decisions.
true, but if you don't fund it, you're still requiring to do it without
Yeah.
appropriation. So you're committing to the appropriation, you're not committing to the appropriation. That's the plan.
Yeah, that's absolutely right.
Well, let us figure out the logistics. Katie, maybe you can help and share Nolan and Stephanie about how we can move this forward. I really would like to see what we could do to move the certification piece forward, particularly since we've already got some money the question is, maybe we have to think about getting this at least started with one time and, I don't know, that was one time, right?
Well, yeah, it's part of the home community-based service plan, that $149 million of 10% bump is according to Rich Donahue, is where they've embedded some money for peer certification.
This is section 10 commits you to fiscal year 26.
Yeah, I know, but that's why I moved that. to cut that.
Okay.
So I'm unclear what you're keeping from the respite portion of the bill. Are you cutting that whole section out?
But in 10,
No, the second half of the bill is respite.
All right, so it's after the findings and stuff.
Yeah,
Yeah.
like, are you creating that new chapter that directs that there are new respites? Or is that whole second half of the bill?
What did the agency, what was their testimony on the show? Agency of Human Services.
Agency of Human Services.
What was their testimony?
What,
Because really,
That-
they're requiring them to, seek approval to amend the plan. You're putting in, obviously, all of this. I just wondered when they came in to testify, what did they say about this?
with regard to the peer support specialists and working with them, I think that was something that, they can certainly live with, that they would engage in. But for the centers,
I don't think they probably could support it at this point.
there's certainly a need. The need is there. The question is, how to pay for it.
Rich Donahue's note was, we don't have the ongoing funding allocated to maintain, so they don't support it unless there's new revenue, and that's the,
For what, the certification or the peer?
this is the peer operated respite centers.
That's true, because there would just be another expenditure on Medicaid. Well, why don't we see how we can deal with the funding and make this work?
Well, I'm sure that, whatever we can do to ameliorate the situation,
Well, we know that, we've been hearing since Irene flooded, the fact that people have been in the emergency rooms for prolonged periods of time. We've added more beds between the hospital, the hospital beds around the state. And it still seems to be a need for more.
and the problem, I don't know that it's, the problem isn't so much the beds in the hospital, it's where do these people go when they're outside?
Well,
And, that's the thing that.
that's why they've been backed up.
They end up back in the hospital, back in the emergency room. And, the hope is that something like this can help keep people out of those situations, those more expensive situations.
Okay, thank you for coming in. I'm sure we can maybe make this work. What else do we have for this afternoon?
We have S187 and I have Senator Lyon and Senator Campion joining us. And Katie's also the drafter. And no one's here for the same vote.
And then we have troops money that we just have to get out with that effective date change, the deputy sheriffs.
Yeah. That's really the solution.
It is. And it really gives us the return on the cost of those positions.
Because once we do it, they can't say that's a change in jobs. And that's
Right.
I didn't realize Stowe went to Washington.
Is this final?
Yes.
That's what Chris said next door.
Yeah, they wanted to get away from their,
They want to get away from what?
they wanted to get away from their representative, their senator.
What's the name isn't gonna be
They
happy.
thought they needed three
Right.
senators representing.
So Bobby, you and Are we still on the air?
We are live.
Why don't we go offline so we can get our next witnesses?
Okay.